most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the top 5 self-treatments for tendonitis of the hip. We just did a video. It should have come out already, actually, on how to tell if you have tendonitis of the hip.
Sure.
So maybe give you some clues. If you do, watch this one, and hopefully we can help you.
That's right.
So there's 2 common hip muscles that get tendonitis, and they both can flex the hip,
Right.
basically.
Bring the knee up.
One's the ILIOPSOAS and one's the rectus femoris. You really don't need to know that, except on the rectus, we are going to do a little bit of anatomy lesson later,
Right.
just so you can see where you're going to do the treatment.
Exactly.
All right, so muscles attached to bone through the thick tendon, and that tendon becomes overused and with repetitive activity, and it gets inflamed, and hence the...
That's what itis.
That's right.
Itis
right.
is Latin for inflammation.
So that tendon can get inflamed, and these are the 5 things that can help calm it down.
Right.
So the first thing, sometimes the tendonitis occurs because those muscles are tight.
Sure.
Especially if you sit a lot,
Mm-hmm.
these muscles can shorten up over time, and if you never stretch it, when you do stand up, you're putting extra stress on that muscle and tendon.
Right. Especially if you're walking, taking long strides, things like that nature.
Yeah. So you're going to want to gently stretch it, because if you stretch it too much, you might actually irritate it.
Right. And go
So-
the wrong direction.
And go the wrong direction, right? So we're going to show you the stretches, and then you could actually use a foam roller or a massage gun may help too.
Right. Nice
and
to have a little assistance sometimes.
If you want to do the lying down
Lie down.
and stretch the hip flexor in a
Absolutely.
prone position,
So-
a supine position.
Both the muscles are likely in general same area in the front of the hip. And if you're lying down, and you can do this on your bed, don't get too close to the edge of the bed so you might feel like you're falling off. Keep your shoulders well on the bed, and then slide your right hip if you're stretching your right hip so it can go off, and let that leg go down. Keep this one here for right now, and this will start the stretch.
That's probably going to be enough for some
Yeah.
people to start off with.
If you bend your knee, it's going to help stretch that rectus femoris a little
forward,
bit.
Yeah.
So a gentle stretch pain is okay. Anything that creates sharp pain, don't do that. It's too aggressive. And then you can take this knee and pull it up like this. And Bob, can you show them what's going on?
See how the hip is going up? That shows there is tightness in there. He's stabilizing the pelvis, and that's why this is coming up. But Brad doesn't have really tight hip flexors, but it shows you even on someone who's not tight, we're putting a stretch on it, and we're
Right.
putting tension.
Someone who's tight, they may be way up here.
Yeah, they may be up there.
You know,
right.
that's not uncommon.
And you'd flip around and do the other side too.
Right,
I mean,
yep.
we-
If
you
you're
know,
on the
you
same
know,
side, you'd have to do this and do the opposite leg as
There
well.
you go. Now another version you can actually do is, if you want to give me the pillow.
Oh, I
Brad.
thought you wanted to shake hands.
Yeah. that type of thing. So we can actually stretch it kneeling down. This is how I tend to do it in the morning.
Yes.
I put it on a pillow and I stretch forward like this, and you can see how I'm stretching that.
Right.
I do this stretch every day.
You're
for sure.
religious on
Yeah,
this
I'm
one.
religious on this one because it really helps your hip.
Yep.
It really, you see I'm keeping really good posture.
Yeah. Look at
Yeah.
this nice
Yeah.
vertical. Yeah, show them the wrong way to do it, Bob. Where you, when you're reaching forward for the
Yeah.
ground, and that's.
And also, you might even take your hand and push forward a little bit and
Yep.
give it a little more stretch
Yep.
if you'd like to really push it along.
That kind of actually forces good posture and the correct motion.
Yeah, sure, absolutely.
Yep.
All right, next one. If it is the rectus femoris, and this is where we're going to do a little bit of an anatomy lesson.
Oh yes. Sam, I am. Good to see you back.
So the rectus femoris actually attaches right to this bone right here. So if you follow along on Brad's pelvis there, and the first big kind of little bump you feel, that's where the rectus femoris
Yep.
attaches.
Right there.
Then it comes down and it blends in, goes to the femur, but blends in with the quadricep muscles. But about 3 inches below this, that bump. So you find the bump, go 3 inches below. That's where the tendonitis tends to occur. Find it, and if it's sore, that's where you can do some cross fiber massage. Cross fiber massage is what Brad's doing right now. You probably want to do it in a seated position where it's under less tension.
Yeah. This is a little bit high. I mean, I think you
Yeah.
could do this lying down.
Lying down, right.
As well, if Sam's
Yeah.
in the way. But, you have to try to get that muscle to relax.
Yeah, you might
And
have it up
work.
on a pillow, but so he's really digging in there when you're
Yeah.
doing this. And what you're looking for is that you start rubbing it, and if after like 20 to 30 seconds it starts to feel better
Right.
or neutralizes.
Yep.
It doesn't get any worse, doesn't get any better, but
Some people say it feels kind of numbish.
Right,
And
right.
that's a good sign.
good sign. If it just keeps getting tender, like you do it and oh, then you're going to stop, probably ice it for a while and let it rest for a while.
Yeah, so we're talking a day.
Yeah,
possibly
day,
more.
right, when we say a
Keep
while.
assessing it. You have to follow the rules as far as continue if it feels better.
But I think if if you can do massage on it 5 minutes a day, you're going to probably be doing pretty well, and that should calm it down fairly quickly.
And if it's painful here, you could go down on the muscle down here.
Sure.
And work that just to get that muscle to relax more and even some more blood flow in that part of the muscle.
Now understand this. This is not taking care of the initial cause of it. The initial cause is
Right.
probably the muscle is tight, and that's why we're stretching, or the hip is not in the socket like it should be.
Little
Yeah.
misalignment.
Yeah, so that's where some of these other exercises are going to help with that. Brad, we forgot to mention a massager.
Oh yes. Oh yeah. In that position, a lot of people
Well,
do
the
have
massager we talked about also for stretching the muscle. Remember, with the first exercise we did, we were going to talk about using the massager to stretch the muscle.
Right.
And we can also okay.
So should we show
Yeah,
them
show
now?
'em,
Yeah.
yeah.
This I think. I just got some green tape on here because if you're going to have a massager, you need to have one that percusses, that moves in and out, not just vibrates. This gets deeper. It's going to be much more effective. And this one actually has our name on it. We know this is a good one. That's why we put our name on it. And you can get in here. And this one has 6 different levels. I usually go to level 3. And I'm going to get in here. The thing about this is it's a lot easier on your hands.
Yes.
My fingers get tired after about 2 minutes as a max or so. Your fingers don't get near so tired.
It does come with different heads too. Like
Yep.
if you get to the point where you really want to get in there, it's got
Ooh.
what you call the pointer.
Yep, and that one's going to get in. I can try that. And this one also, I probably use the round one more, or the one I just had, which is an air-filled one.
Yeah, that air-filled one is a cool one.
But you do have to be careful with this. That
Yeah,
you
the
don't.
pointer. Yeah,
Yeah.
that gets aggressive.
I'm going to just start on number 2. That's a little lower. There, and I can get right over that.
Yeah, I actually think that might be the one for this, Brad.
Yeah.
To be honest with you.
It's going to depend on the individual. Some people that are really thin, because you don't want to go on your bone over the pelvis. You'll know because it just doesn't feel good when you're over a bone.
But again, you can actually use the massager over the entire muscle to
Right.
help
Yep.
make it more flexible and pliable.
You bet.
And that way it's going to be less likely to injure in the future. So you can
Absolutely.
do this with a foam roller too. I don't think we need to show that, Brad. But you can roll over a foam roller.
Sure.
So, all right, number 3, this is where you're actually trying to solve the problem here. You're going to strengthen the glutes. It's kind of hard to explain, but they help stabilize the hip. And if it's unstable or it's moving forward a little bit, those tendons can rub over it and cause problems. So especially the glute maximus and medius. So I'm going to show you just one easy exercise to do is just clamshells. You're just going to lie on your right side or left side,
Sure.
whichever one. I'm working the upper one right now, so the left
Right.
side. So basically you're putting your ankles and feet together and you're making a clam.
Yep.
Saying, hi, Brad.
Oh,
how are
yeah.
you?"
Or, if you're like me, back in the 80s, you played Pac-Man, that's what it reminds me of. Sorry, I digress. Let's go back to the exercises.
So anyway, you can start off doing 5 to 15 reps, depending on do it until fatigue. Eventually, you might add some bands to it.
Look at Bob's feet. He keeps his feet together. That's a pivot point because that really, then you know you're doing the mechanics properly. And it's harder than you think.
Yeah, especially if you have done these before. I made the mistake of doing it with a black band right away.
So the rubber, the loop that goes around.
Yeah, exercise band, and I got so sore. I honestly I couldn't lie on my hip for a long
Yeah.
time. I had to I had to sleep on the other side, and
Right.
so, it
So
was a big
starting without a band is a good option.
deal. Yeah. All right. The next one is gluteal pumps. Another exercise for the. You mind if I do these two, Brad?
Sure.
So you can lie down on your stomach doing these like this lat, and just lift up like this, and you're going to lift up like this.
Keep in mind the glute muscle, the glute max particularly, works directly with the hip flexors that we're working with. So if this muscle is working, it allows the other muscles to relax. It's just
Yeah, it's a weird concept. Yeah, the muscles do opposite things on opposite side of the body. So
Right.
this muscle is working. The hip flexors have to relax.
Yep. And you don't even have to think about it. That's just the nature
Right,
of the
that
body.
just does what it's going to do. Now you can do this in the quadruped position too. A little more tougher probably.
Sure. Notice Bob has his knee bent.
I don't know, is it bent to 90 degrees? I can't even tell.
It's pretty close, which emphasizes more work on the glute muscles, which we want to do. So do it in that manner. Don't bring your knee way up by your butt. We don't want to get you to hamstring cramp. Just about like this is.
Yeah, I don't want to go like that is what you're
Right,
saying, right? Yeah.
yep.
Okay. All right, the last one is a little bit difficult to understand too, but you want to walk correctly. If you're walking, and sometimes people, they tend to use their hip flexors too much when they're walking. So
Sure.
they're actually, when they walk, they take a step and they're lifting the leg.
Sure.
But you should actually propel off the leg. So if I'm moving forward here, I'm going to push off this one instead of lift this one. Does that make sense, Brad? I'm going to push off, push off, push off.
Yeah. It is kind of a weird thing. You have to. It's how you think.
It's going to help if you do these other things. If you probably take shorter steps.
Right.
If you take really long steps, you're gonna try to lift the leg forward to
Yeah.
do that. And you also want to try to hit on your mid-foot or mid-arch as opposed to hitting on your heel. If you hit on your heel, you're actually going to not engage the glutes as much. You're going to fire
Yeah.
up the hamstring a little bit there.
So it's more of a flat foot. And you know, sometimes, you know, I always try, if I'm walking fast, I always think, oh, I got to reach way out there. But that puts a little more stress on the hip and the back. So think about not reaching so far out and landing more flat-footed.
I know this is a difficult one. If you can't do it, just work on the glutes, you know. But
Right.
it's a concept that Brad and I both kind of embraced with our running.
Right.
And it made a big difference. In
Yeah.
fact, I was getting hip flexor problems with my running until I did that, until I started shortening up my stride. I go faster, but I go more forefoot running
Right.
than heel to toe running. And this all makes a big difference. So you have to trust us on this one. So this program, by the way, this actually video is a part of a series of videos on hip pain.
Mm-hmm.
Just go to bobandbrad.com, go to the program section, and in that program section, you'll see it listed for hip pain.
Right.
We also have one on sciatica, plantar fasciitis.
There'll be a whole series that we don't.
Yeah.
It's like somewhere between 10 and 20 videos.
Oh, I think we got more now on the hip.
Well, there's a lot. So we're
yeah.
still working on them.
Right, yeah, we're still working on it. There's going to be 20-some.
But you can go to them, look at them, and the nice thing about it, you can print out a PDF of summary of the
Each video,
exercises.
it comes along with it.
Yep.
Absolutely free. We don't ask an email or anything of you. This is something we're doing for all of you because we love you.
That's right.
All right. Thanks for watching.
Be careful.